What are the signs of the stroke? Are they sudden or gradual? And what should you do when a stroke occurs? My name is Bal Athwal. I'm a consultant neurologist for HCA Healthcare at the Wellington Hospital. Today I'm going to be answering some frequent questions about stroke. A stroke is when there's a sudden disruption of brain function, usually in a section of the brain, usually related to either a blood vessel being blocked and lack of blood flow, or sometimes some bursting of a blood vessel and a hemorrhage into part of the brain. The effect of a stroke depends on where it is and how large it is. Typically, stroke will cause an area of brain to stop working, and the effect then is the part of the body that area works on will stop working as well. An example might be sudden loss of the ability to either speak or understand language because the language center of the brain has been disrupted. Another example might be sudden weakness of an arm because the movement center of the brain has been affected. Early treatment for stroke is usually only possible within the first 3 to 5 hours or so the critical thing is the patient is transported to the correct facility as quickly as possible. One very important thing to remember is that a lot of patients will experience symptoms before a stroke occurs. Typically these will be what we call a TIA. TIA stands for transient ischemic attack, and it is when there is a short-lasting interruption of blood supply to part of the brain, and then when the blood supply is restored, the brain recovers. The patient might experience a short period of symptoms. For example, there might be a few minutes or an hour or so of interruption of ability to speak, or there might be a similar duration of weakness of an arm and leg. If these symptoms occur, it is extremely important not to ignore them. The reason is that if the patient can be assessed medically and given the correct treatment, there can then be a very major reduction in the risk of a stroke occurring after that. Untreated, there's a very high chance of a full stroke happening within the next few days and weeks. It is important to stress that people do recover when they have had a stroke. Recovery can be prolonged, and sometimes patients who are badly affected need extra support to help them carry on with their normal lives. Stroke recovery takes time. In the initial days and weeks, there is often rapid recovery, and then there's a slower recovery after that. For some patients badly affected, this can be a long journey. For other patients who have very mild stroke, the period that they're affected by symptoms can actually be quite short. Everybody's journey is different in this because everybody has different types of stroke in different locations and of different sizes. Most strokes are not hereditary, meaning that there's no direct genetic basis for strokes, except in a very few limited disease circumstances. However, the factors that contribute to stroke may have a hereditary basis. For example, high blood pressure might run in families. High cholesterol and diabetes may also run in families. All three of those contribute to stroke, and there may be stroke disease running in a family as a result of those risk factors. I'd really like everyone to think about how they can lead a healthy life, and one element of that is trying to reduce the risk of a stroke happening. We think stroke is influenced by various risk factors. These are smoking, diabetes, high blood pressure, and high cholesterol. Those are the main ones, and all of those can to a certain extent be modified.